Good day everyone. I am Dr. Sunila Nagvekar. I am a pediatrician practicing in Borivali. Today I will be speaking to you about Aefi and safe vaccination practices. Now what does Aefi mean? Aefi means an adverse event following immunization. It can range from mild to severe. An adverse event can be anything which is not correct or not right and it follows an immunization. It does not mean that it is caused by an immunization. It has just followed an immunization. The most important strategy to deal with an AEFI happening in your clinic is to have adequate counseling, be prepared for the AEFI, anticipate an AEFI by adequate observation, and take prompt action when an AEFI occurs. Now let's go on to the definition of an AEFI. Adverse event following immunization is a medical incident that takes place after immunization. It causes concern and is believed to be caused by immunization. Any untoward medical occurrence which follows immunization and which does not necessarily have a causal relationship with the use of a vaccine can also be clubbed under AEFI. An adverse event following immunization includes any unfavorable sign like fever, any unintended sign like an abscess, any abnormal laboratory finding like low platelets or thrombocytopenia, any symptom like seizures, or any disease like VAP which follows oral polio vaccine. Let us go on to the types of AEFI. The first one would be a vaccine reaction, second would be an injection reaction, third would be a program error, fourth could be coincidental, and the fifth is highly unlikely or unknown. Let's go on to the first one, that is a vaccine reaction. Vaccine reaction is an event which is caused by the vaccine. Example, vaccine-associated paralytic polio which follows the oral polio vaccine. Or it could also be any event which is precipitated or exaggerated by the vaccine when it's given correctly also. Like a febrile seizure in a predisposed child. That means if a child is genetically or constitutionally known to develop febrile seizures, vaccine may be just a coincidence which has increased the chances of getting that febrile seizure due to the fever caused by the vaccine. Next, we'll go on to an injection reaction. They can be of three kinds. One could be because of the anxiety related to an injection, which could be syncope. So syncope is when a person is very scared of a vaccine, that is, he is very anxious and he can have sudden loss of tone or consciousness and have a fall after the injection or even looking at an injection before it's given. This is called as syncope. Next would be pain. Pain could be because of an abscess which can cause after giving the injection. Abscess is a collection of pus at the injection site in case of immunization. Third would be the injection itself. In case an injection is injected accidentally into a nerve, it can cause nerve damage. Next, it could be program error. That is the third type of AEFI. Program error means anything which has an error in preparation of the vaccine, in handling of the vaccine, or during administration of the vaccine. For example, suppose a measles vaccine is reconstituted and kept for a long time, that is beyond half an hour, it could lead to toxic shock syndrome in a child. Or if BCG is kept reconstituted beyond the designated 4 hours or at a wrong temperature, this is inadequate preparation or incorrect preparation and handling. Same way, if an intramuscular injection is inadvertently injected intradermally or any route of administration is in error, it could be a program error. Another thing is the vaccine handling. There are a lot of times, especially during the primary series of immunization, when we give multiple vaccine antigens at the same time. These come in separate packs. Now, if we mix two vaccines which are not meant to be mixed together in an injection and administer it, this is an administration or handling error or a program error. This could lead to AEFIs. That's why we need to be very trained that use the diluent which comes with the vaccine, Do not mix vaccines which are not to be mixed. Maintain a particular distance of 1 inch between two vaccines if they are given on the same side. Next, let's go on to coincidental. Coincidental adverse events following immunization mean events which have occurred after immunization but which are not caused by the vaccine, neither by a vaccine reaction, nor by an injection reaction, nor by a program error. This is happening only because of pure coincidence. For example, sudden infant death syndrome or cot death, known in common language, peaks around the age of immunization, that is, in infancy. So, it's very likely that you may have a sudden infant death happening after immunization but not because of immunization. It's just happening as a coincidence. That's a coincidental AEFI. And we come to the last category, that is an unknown AEFI, where there is an undetermined cause for the adverse event. Now that we have seen that, let's classify the AEFIs based on the severity. First is a minor AEFI, which includes three types: local, allergic and systemic. Minor reactions could be swelling, redness, pain at the site. These are local reactions at the site of the injection. Next could be allergic reactions, which could be mild like skin rashes or sweating, or it could be severe like anaphylactic shock. Third would be systemic reactions. Systemic reactions means reactions which affect the whole system, which could be fever, malaise or lethargy, any loss of appetite or a headache. Next, we'll go on to the severe adverse events following immunization. This is the most serious category of adverse events, which include disability, a cluster of AEFIs, that means involving multiple systems, adverse events involving hospitalization, and the last and most severe category, that is death. Now let us see what is the definition of serious AEFIs. The reason we are focusing more on serious AEFIs and not the minor AEFIs is because serious AEFIs cause fear into parents, fear into the doctor with whom they have occurred, and it hampers the immunization program in general. The negative publicity, thanks to social media, has become so widespread that even a minor AEFI can cause many serious implications for the immunization program. So, it's very important that minor AEFIs are already counseled about and serious AEFIs should be prevented, and if they occur, they should be dealt with in the right way. So, let us see what comes into the definition of serious AEFIs. First would be any event which is fatal or life-threatening. It could be anything which causes permanent or significant disability or incapacity like VAP. Anything which results in hospitalization or which prolongs the hospitalization in a person. Or anything which results in congenital or birth defect. Let's go on to the minor reactions first, that is the local reactions. Now, we should be counseling parents before vaccination about any mild pain, swelling and erythema which can occur after vaccines, especially after the whole cell pertussis vaccine. Stroking the skin adjacent to the vaccine site helps to decrease the pain of the child. Similarly, ice application at the site of pain or injection can also reduce the pain in killed vaccines. You should counsel the parents that local reactions are more in subsequent doses and frequently administered doses of tetanus toxoid. This can help the parents be priorly prepared for the pain and irritation of the child. This also helps increase the confidence of parents in the doctor and into immunization. Next, let's go on to the systemic reactions and how should we deal with it. Now, fever is the commonest reaction which occurs on a systemic basis. Usually, it does not last beyond 48 hours. If a fever after immunization is lasting more than 48 hours, we should definitely evaluate for any other causes. We should also counsel the parents beforehand that fever can occur after any vaccine, but most of the times it is mild. If there are any vaccines which are highly likely to cause fever and pain or high fever, parents should be warned about it beforehand and told about how to deal with it. For example, the whole cell pertussis or aluminium containing vaccines. Also, unlike local reactions, fever decreases with subsequent doses of the vaccine. Also, fever decreases with increasing age of the child. Now, oral paracetamol, which used to be given empirically earlier with every vaccine, is no longer to be given empirically, because oral paracetamol has been found to blunt the immune response of the vaccine if it's given on a daily basis. Oral paracetamol should be given only if required to the child, that is, if the child has high fever. At the same time, giving oral paracetamol should be judged judiciously, especially in children who are predisposed to have febrile seizures. If a child is not given paracetamol and he develops a febrile seizure, then the parents may be reluctant to vaccinate the child again because of the fear of seizures. So oral paracetamol is not to be used prophylactically or empirically, that is, when there is no fever. It should be given judiciously in children who are predisposed to febrile seizures, and most importantly, parents should be counseled about paracetamol to be given only if required and not to be given as a routine following every vaccination. Let's go on to the next category, that is allergic reactions. Common allergic reactions like skin rashes or discoloration of the skin are minor. What we are really worried about in an allergic reaction is the most severe form of allergic reaction, that is anaphylaxis. Anaphylaxis can occur with any vaccine. It's very common after the first dose of a vaccine antigen. The way to prevent or to anticipate an anaphylaxis is to observe every child for 15 minutes after every vaccination. It can also be done in your waiting area by your staff, but they should be prepared to notice anaphylaxis occurring. That is, if the child gets breathless, develops sudden skin rash, if the child has profuse sweating, flushing. These are the minor or major signs which will come immediately after giving a vaccine. Now, anaphylaxis is rarely to any vaccine antigen. Most commonly, it is to the stabilizers or preservatives like thiomersal which are present in the vaccines. Or it could also be to any residual animal protein like eggs into the vaccine. Now, how will we deal with anaphylaxis? That is the management. Anaphylaxis reaction is an immediate reaction. It most commonly occurs within few minutes of vaccination. Cases have been known to occur up to 24 and 48 hours, but most commonly it is within few minutes. And these are the minutes which are in your hands. If you observe the child for 15 minutes after vaccination, you are very likely to detect the major cases of vaccination promptly. Anaphylaxis is a life-threatening emergency which has to be dealt with promptly and detected promptly in the first place. So, your emergency equipment has to be kept very handy. All the personnel in your clinic should be told about the location of the emergency equipment. All the staff should be instructed to make patients wait for 15 minutes under observation to detect an anaphylaxis promptly and to treat it in time. Nearby hospitals and ambulance services numbers should be ready with the staff so that a patient can be shifted to a hospital after giving emergency resuscitation. Now let's go on to the equipment which is required in a clinic after an anaphylaxis reaction. You would require an airway, an umbu bag, a mask, an IV access like a vein flow or a cannula or a scalp vein, an oxygen cylinder, injection adrenaline in the 1:1000 dilution, injection hydrocortisone and normal saline. It's very important to check the expiry dates of all your injectable medications regularly. Next, let's go on to the treatment. We need to administer epinephrine or adrenaline in the 1:1000 solution promptly in 0.01 ml per kg per dose intramuscularly into the anterolateral thigh. Maximum dose allowed is 0.5 ml. We need to set up an IV access into the patient, lay the patient flat, elevate the patient's legs if tolerated, give high flow oxygen, maintain the airway if it is compromised, and ventilate with an umbu bag if required. Next, if the patient is hypotensive, that is, he has low blood pressure, set up additional wide bore IV access, give IV normal saline by 20 ml per kg under pressure over 1 to 2 minutes. You can repeat an intramuscular adrenaline after 3 to 5 minutes if required. Oral antihistaminic can be given to relieve the skin symptoms. IV antihistaminic is not recommended. Oral or injectable corticosteroids may be given, but the benefit is unknown. Now, what do we tell parents? Most of the times, parents as well as doctors and clinic staff panic after an anaphylactic reaction. The most important rule in any emergency, including anaphylaxis, is don't panic. Tell the parents in a calm voice that you are equipped to deal with the emergency and you will explain everything once you have started the treatment. But treating the child right now is a priority. Explain that allergic reactions are a known possibility, but they are uncommon. Explain about the hospitalization observation required after such a reaction to the parents in a very calm way. Document the reaction on the vaccination chart to prevent repeat of the same reaction in future. Explain the importance of telling about the reaction to the doctor before any future vaccination. Now, after considering about these adverse events following immunization and after reading about dreadful anaphylactic shock, it comes to a question that should we vaccinate with such a risk of AEFI? So what we should know? Vaccine is considered safe only when the benefits outweigh the risks of not immunizing the child. Serious adverse events following immunization have a relatively low rate of 1 in 10 lakhs. Close watch should be kept about how this message of anaphylactic reaction spreads, as it can affect the masses. It also affects the immunization program in general. But yes, we should vaccinate. Now, when we consider the adverse events following immunization, we should also know about how do we counsel a parent about a vaccine considering the background of adverse events following immunization. So, we should start with why a vaccine is necessary. What does it protect you from? Which diseases? What could be the complication of these diseases? Milder disease courses happen after vaccination if they occur at all. This should be a fact which should be emphasized to the parents that no vaccine is 100% efficacious, but if in case a disease occurs, the course is definitely milder. This will help the parents understand importance of the vaccine and also make them more confident about taking it. A lot of parents will ask us this question that doctor, can this vaccine have any side effects? Can we answer there are no side effects? No. With the chances of adverse events, we can never say there are no side effects. Also, should we scare every parent about anaphylactic shock? No, it's not required. It's a very rare complication. What we should say is the truth, that vaccines are safe, but reactions can occur. Vaccines are released for general use only when the benefit of taking the vaccines outweighs the risk of not immunizing that child. Serious reactions are rare after vaccination. Even if they occur, we are equipped to deal with serious emergencies. Minor reactions which can occur like fever, swelling, erythema should be explained priorly, and the relief measures which can be applied for such reactions should be explained in advance. It's most important to reassure our parents, vaccinate our children, and then reassure the parents and children both after vaccination. So assure, vaccinate, and reassure. Next, what can we do about the child? Till now, we were only speaking about how we can explain and counsel parents. What can be the simple measures which can be taken before vaccinating the child to make vaccination a more painless procedure? We can offer simple soothing measures like playing or singing to the child by the parent. We can make the child comfortable by making him play with some toys before vaccinating. If it's an older child, we can try to counsel the child or talk a little with the child about his hobbies in school. We can vaccinate them in a playful manner. We can try to explain the benefits of a particular injection in an older child, especially the knowledgeable age group who are very interested in the why and how of a vaccine. If it's a very young child, we can try vaccinating while the child is in the mother's lap or while breastfeeding. This is said to decrease the pain associated with vaccination. Next, let us go on to a very important part of vaccination and to deal with any adverse event following vaccination. This is a very neglected part most of the time, so it's very imperative that all pediatricians are aware about the right documentation following vaccination. Documentation involves writing down the batch numbers of every vaccine given to the child. We should ensure we write down brand names. Try to maintain the same brands when available. Interchangeability of brands should be avoided whenever possible. Write down the date of vaccination and sign alongside as a proof. Document the next vaccine to be given with its name and due date. Inform the parent about the minimum interval between the next vaccine to be maintained if applicable. Like, if we are giving 2 live vaccines, we need to maintain a minimum distance of 4 weeks between the 2 vaccines. This should be explained to the parent to avoid miscommunication. Similarly, we should write down the dose of the antipyretic to be taken, that is paracetamol, which is to be taken only if required and should be taken if required. Now, in spite of our best precautions, we may still have a serious adverse event following immunization in our clinic. What should we do? After this, we should report it to the medical officer of our concerned area. We need to fill a first information report or an FIR to report to the district officials. The district immunization officer and district adverse event following immunization committee members will come and investigate the incident. We should help the investigative team in collection of information. Now, how do these people evaluate an adverse event following immunization? Is an evaluation done to pinpoint the doctor, the vaccine? No. An adverse event following immunization evaluation is done to rectify the fault, if any. It is not done to take punitive action or to pinpoint a fault on anybody. What an AEFI evaluation involves is it tries to assess the causality. Causality means whether the second event or whether the adverse event which has occurred is a consequence of the first event, which is immunization. This is what it tries to assess. This is assessed by the WHO, World Health Organization causality algorithm, which is used to determine causality. There are 2 questions in this algorithm. Is there evidence in literature that this vaccine can cause the reported event if given correctly? For example, if there is any redness or swelling after a whole cell pertussis vaccine, this is reported in literature. So this would not be considered as something very unusual. Did the event occur within an appropriate time after vaccination? This is the second question. For example, you will not report an event 1 and 2 years after a vaccination. There are specific times after a particular vaccination when certain adverse events can be linked to the vaccine. This is the second question in the WHO algorithm. Next, let us go on to the classification of the causality. Classification of causality means, in terms of the cause of the adverse event being vaccination, we need to see whether vaccination was definitely the cause, probably the cause, possibly a cause, or vaccination was unlikely to be the cause of this adverse event. Sometimes it is not possible to prove or disprove causality definitely. Now, let's go on to certain tips for private practitioners about dealing with an AEFI. First tip, maintain meticulous records of the vaccine brand, date, and batch number. Maintain a logbook of your refrigerator temperature. Maintain the entries of batch number and clinic records also. Counsel your parents prior to vaccination. Never say there are no risks or there are very high risks. Be pragmatic about explaining the risks. Be prepared to deal with any emergency, and most important, if you have an AEFI, report the AEFI. It strengthens the system. Now, you will ask me, why should we report an AEFI? Why should we go through such a big investigation? Now, 10 to 20% of vaccination in India is done in the private sector. Vaccines are not in the national schedule. So, those vaccines which are not in the national schedule have no safety net to be tracked. Reporting an adverse event following immunization helps in tracking the safety of these vaccines. It can also help track down a contaminated batch if any. It helps to strengthen the immunization surveillance program. It will help to detect if there is any other cause for that adverse event and not just the vaccination. Also, you can change the vaccine type if vaccine is the cause. For example, if whole cell pertussis is leading to some adverse reaction, you can change to a cellular pertussis, which is known to cause fewer reactions. Similarly, You can rectify any errors either in the vaccine storage, handling, administration, preparation, or in the mixing of the vaccines. We should always remember that reporting of AEFI is done to cause corrections in the way we give our immunization and not to take punitive action against anybody. The references which I have used for this presentation are the IAP Guidebook on Immunization 2013-14 by ACVIP and Vaccinology Simplified, which is a book by IAP with Aurangabad Academy of Pediatrics. Be wise, vaccine wise, immunize. Thank you.